Good morning, students. Today we will see the hematology part 2. As I told you earlier, this is not a replacement for your textbook or your regular classes. It's just a supplement for your studies, just to revise what you have learned. So we'll go to the next question, that is the blood volume. Total amount of blood present in the circulatory system. Blood reservoirs, organs and tissue together constitute the blood volume. In normal healthy adult, the male weighing about 70 kg, the blood volume is 5 liters. In the variations of blood volume, there is two types of variation: physiological variation and pathological variation. Physiological variation include age. At birth it is less and it is increasing with the age advances. It is high in male and less in female. Surface area of body, it is directly proportional to surface area of the body. It is directly proportional to the body weight. Atmospheric exposure to cold reduces the blood volume. Pregnancy blood volume increases to 20 to 30% in pregnancy. Exercise increases the blood volume. Erect posture reduces the blood volume. High altitude blood volume increase in high altitude. Emotion excitement blood volume because of the sympathetic stimulation, which causes splenic contraction and release of stored blood into circulation. Pathological variations are: abnormal increase in the blood volume is called as hypervolemia, and abnormal decrease in the blood volume is known as hypovolemia. Regulation of blood volume. Most important regulation is by renal and hormonal mechanism. Hypothalamus plays a major role in activation of two mechanisms during regulations of when the body volume decreases, hypothalamus causes loss of fluid from the body. When the body volume decreases, hypothalamus induces retention of water. Hormones involved in the regulations of blood volume are antidiuretic hormone, aldosterone, and cortisol, and atyl natriuretic peptide. And the functional lymphocyte constitute of 20 to 40% of WBC in the adults. They play a major role in immunity. Functionally, lymphocytes are classified into two categories: T lymphocytes and B lymphocytes. T lymphocytes responsible for cellular immunity, and B lymphocytes are responsible for humoral immunity. Cellular immunity activated provided by the T lymphocyte is known as cellular immunity. These cells encounter and destroy organisms enter the body. It also called cell-mediated immunity or T cell immunity. It is the major defense mechanism against infections by virus, fungi, and few tubercle bacilli. Cellular immunity also responsible for delayed allergic reactions and the rejection of transplanted tissue. Humoral immunity is provided by the activation of B lymphocyte. It is also called B cell immunity. B lymphocyte fight against invading organism by secreting antibodies into the blood and lymph. Blood and lymph are body fluids, and B lymphocyte provide immunity through humors. Therefore, this immunity is known as humoral immunity. It plays an important role in defense mechanism against bacterial and viral infections. Classify WBC. Explain morphological features and functions of each and functions of WBC. Classification. It is classified into two groups depending on presence or absence of granules in cytoplasm, that is granulocyte and agranulocyte. Granulocyte are neutrophils, eosinophils, basophils. Agranulocyte are without granules, they are monocyte and lymphocyte. Neutrophils, they are also known as polymorphs, have fine or small granules in the cytoplasm. The granules take acidic and basic state. The nucleus is multilobed. Number of lobes in the nucleus depend upon age of the cell. In younger the cell, the nucleus is not lobed, and neutrophils, the nucleus has 2 to 3 lobes. Diameter of the cell is 10 to 12. The neutrophils are ameboid in nature. The functions include: it plays an important role in defense mechanism of the body. Along the monocyte, neutrophils provide the first line of defense against invading microorganisms. It also secretes platelet activating factor, which accelerates the aggregation of platelets during injury to the blood vessel. Eosinophils, they have coarse granules in the cytoplasm which stain pink or red with eosine. The nucleus is bilobed, spectacle shape. Diameter of the cell varies between 10 to 40. The main function include: they play a major role in the defense mechanism of the body. These leukocytes are specially meant for acting against parasites, so their count increases when parasitic infections and allergic condition. They are also responsible for detoxification, disintegration, and removal of foreign proteins. Basophils also have coarse granules in the cytoplasm. Granules stain purple blue with the mother in blue. Nucleus is bilobed. Diameter is 8 to 10. The functions include they play a major role in healing process, though their number increases during healing process. So they also play a major role in acute hypersensitivity reaction. It is because of the presence of IgE receptors of basophil membrane. Monocyte. They are the largest leukocyte with a diameter of 14 to 18. Cytoplasm is clear without granules. Nucleus is round, oval, horseshoe or kidney shape. Nucleus is placed either in the center of the cell, and the main functions include these are largest cell among leukocytes. They play a role in defense mechanism. Along with neutrophils, these leukocytes provide the first line of defense. Monocytes are precursors of tissue macrophages. Lymphocyte, like monocyte, this also not having any granules. Cytoplasm nucleus is oval, bean or kidney shape. Nucleus occupies whole cytoplasm. The rim of cytoplasm may or may not be seen with they play important role in immunity. Erythroblastosis fetalis. When Rh negative mother carries Rh positive fetus, usually the first child escapes the complications of Rh incompatibility. This is because Rh antigen cannot pass from fetal blood to the mother's blood through the placental barrier. However, at the time of delivery, the child Rh antigen comes from the fetal blood leaks into the mother's blood because of the cutting of the umbilical cord. During the postpartum period, the mother develops Rh antibody in her blood. When the mother conceives for the second time and if the fetus happens to be positive again, Rh antibody from the mother's blood crosses the placental barrier and enters the fetal blood. Thus, only Rh antigen cannot cross the placental barrier, whereas Rh agglutinin can cross it. The Rh agglutinin which enters the fetus causes agglutination of fetal RBC resulting hemolysis. Prevention. If the mother found to be Rh negative, fetus is positive, anti-D should be administered. Mother at 28th and 34th week of gestation as prophylactic measures. If the Rh negative mother deliver an Rh positive baby, anti-D should be administered to the mother within 48 hours of delivery. The baby born with erythroblastosis fetalis, the treatment is given by means of vaccine transfusion. In the severe hemolysis, fetus causes jaundice. The compensate hemolysis of the more number of RBC, that is rapid production of RBC, not from the bone marrow but also from liver and spleen also is produced. Now, many large and immature cells in the pro-erythroblastic stage are released into circulation. Because of this disease is known as erythroblastosis fetalis. Humoral immunity. Humoral immunity or a humoral immune response, an aspect of immunity that is mediated by secreted antibodies which involve T lymphocytes produced in the cells of B lineage. B cells are transformed into plasma cells which secrete antibody. Mediating antibodies are formed in the antigen-specific B lymphocyte. Some cells revert to the small lymphocytes, memory cells, and expanded clone to these cells on re-exposure to the antigen undergo further lymphocyte blastogenesis, leading to further increased antibody production and numbers of memory cells. There are two types of humoral immune response, primary and secondary. Primary response begins immediately after initial contact with the antigen. Resulting antibody, predominantly IgM, appears 48 to 72 hours later. Secondary response occurs 24 to 48 hours and produces larger quantities of IgG. The secondary response persists much longer than the primary response and is a result of repeated contact with the antigen. Mechanism of coagulation of blood. Coagulation of blood occurs through series of reactions due to activation of group of substances. This group of substances are known as clotting factors. 13 clotting factors has been identified. Most of the clotting factors are proteins in the form of enzymes. Normally, all these factors are present in the form of inactivate proenzyme. Stages of blood clotting include formation of prothrombin activator, conversion of prothrombin into thrombin, conversion of fibrinogen into fibrin. Stage 1 formation of prothrombin activator. It is formed either with the blood itself or outside the blood. Thus, formation of prothrombin occur in two pathways: extrinsic pathway and intrinsic pathway. Stage 2 conversion of the prothrombin into thrombin. Blood clotting. All about the thrombin formation. Once thrombin is formed, it is definitely leads to clot formation. The prothrombin activator that is formed in the intrinsic and extrinsic pathway convert prothrombin into thrombin in the presence of calcium. Once formed, thrombin initiate formation of more thrombin molecules. The factor 5 turns accelerate formation of both extrinsic and intrinsic prothrombin activator, which convert prothrombin into thrombin. Stage 3 conversion of fibrinogen to fibrin. The final stage of blood clotting, which involves conversion of fibrinogen to fibrin by thrombin. Thrombin convert fibrinogen to activated fibrinogen due to loss of 2 pairs of polypeptides from each fibrinogen molecule. The ameboid fibrinogen is called as fibrin monomer. The fibrin monomer polymerizes with other monomer polymer to form loosely arranged strands of fibrin. Later, these two loose strands are modified into dense and tight fibrin threads stimulating factor. Platelets. Platelets or thrombocytes are formed as element of blood. They are small, colorless, nucleated and moderately refractive bodies. Platelets are constituted by cell membrane that is 6 nanometer, contain lipids in the form of phospholipid, cholesterol and glucocalyx and glycoproteins. Microtubules, they form ring around the cytoplasm below the cell membrane. They are made up of polymerized proteins called tubulin. They provide structural support for inactivated platelets to maintain disc-like shape. Cytoplasm of platelets contains cellular organelles, Golgi apparatus, endoplasmic reticulum, mitochondria, microtubule, and different types of granules. The normal platelet count in 2.5 lakhs. It ranges from 2 lakhs to 4 lakhs cubic millimeter of blood. Physiological variations are age. Platelets are less in infant, but it comes to normal by 3rd month. Sex, there is no difference in male or female. As the altitude increases, platelet count increases. After the meals taking food, platelet count increases. Functions of platelet: role in blood clotting, role in clot retraction, role in prevention of the blood loss, and role in repair of the unruptured blood vessel, that means ruptured blood vessels, role in the defense mechanism. Average lifespan of platelets is 10 days. It varies from between 8 to 11 days. Platelets are destroyed by tissue macrophages system in the spleen. So splenomegaly decreases the platelet count and splenectomy increases the platelet count. Pernicious anemia. It is the anemia due to deficiency of vitamin B12. It is also called as Addison's anemia. It is due to atrophy of gastric mucosa because of autoimmune destruction of parietal cells. Gastric atrophy results in decreased production of intrinsic factor and poor absorption of vitamin B12, which is the maturation factor for RBC. The RBC are larger and immature with almost normal or slightly low HB level. The synthesis of HB is almost normal in this type of anemia. So cells are macrocytic and normochromic, sometimes hypochromic. It is also common in old age, and it is more common in female than in male. Associated with other autoimmune diseases like disorders of thyroid gland, Addison's disease. Characteristic features are lemon yellow colored skin due to anemic paleness and mild jaundice and red sore tongue. Neurological disorders like paresthesia, progressive weakness and ataxia observed in extreme conditions. Pernicious anemia due to inability to absorb the vitamin B12 from the gastrointestinal tract. Humans get vitamin B12 from animal products, both meat and dairy products. Body is able to store vitamin B12 for a long time, so inadequate dietary intake must persist for years before true deficiency occur. Because of this, symptoms of pernicious anemia usually does not appear for years. While pernicious anemia is most commonly diagnosed in adults with the average age of 60, congenital type of pernicious anemia also has been described. Symptoms of anemia due to reduced oxygen carrying capacity, shortness of breath, fatigue, dizziness, pale skin can occur with anemia. Heart is placed under stress since it has to work harder to deliver enough oxygen to the body tissue. This can result in heart murmurs, fast heartbeat, arrhythmias, enlarged heart, or even heart failure. It is important to note that all people Not all people who have vitamin B12 deficiency and neurological symptoms, they will have anemia. The symptoms of pernicious anemia if the condition of pernicious anemia responsible for vitamin D, it is given as IM injections, injection of 1,000 micrograms of vitamin B12 generally given every day for 1 week followed by 1 milligram every week for 4 weeks. Alternative treatment are high dose of oral vitamin. Oral dose is required more 200 times higher than the minimum daily vitamin B12 for the adults is significantly higher. Nasal spray, sublingual also available. Immunity. Immunity is a biological term describes the state of having sufficient biological defense to avoid infection, disease, or other unwanted biological invasion. In other words, it is nothing but capability of a body to resist harmful microbes from entering into the body. It involves both specific and non-specific components. The non-specific components act either as barriers or as eliminators of wide range of pathogens irrespective of antigenic specificity. Other components of immune system adapt themselves to each new disease encountered and are able to generate pathogen-specific immunity. Innate immunity or non-specific immunity is the natural resistance with which a person is born. It provides resistance through several physical, chemical, cellular approaches. Microbes first encounter the epithelial layers, physical barriers that line our skin and mucous membrane. Subsequent general defenses include secreted chemical signals, antimicrobial substance, fever, phagocytic activity associated with inflammatory response. Phagocytes express cell surface receptors that can bind and respond to common molecules patterns expressed on surface of invading microbes. Through these approaches, innate immunity can prevent colonization, entry, and spread of microbes. Adaptive immunity, they are subdivided into natural acquired immunity and artificially acquired immunity. Both naturally and artificially acquired immunity can be further subdivided depending on whether the immunity is induced into the host passively or transferred from the immune host. Passive immunity is acquired through the transfer of antibodies or activated T cells from the immune host, usually lasting only for few moments, but active immunity induced from the host itself by antigen lasts for longer. Complications of blood transfusion. Blood transfusion is a life-saving measure and should be carried out when it's absolutely essential. The complications are include mismatched transfusion reaction. They are characterized by agglutination, tissue ischemia, hemolysis, hemolytic jaundice, circulatory shock, hemoglobinuria, acute renal shutdown, and uremia. Circulatory overload due to hypervolemia may occur following blood transfusion when transfusion is rapid, especially in patients with cardiac diseases. Transmission of blood-borne diseases. Pyrogenic reactions characterized by fever and chills may occur due to destruction of leukocytes. Allergic reactions like skin rashes, asthma may occur if the donor blood contains substance which the patient is allergic for. Hyperkalemia may occur after excessive transfusion of blood because potassium concentration in the stored blood is high owing to the leakage of potassium from the RBC into the plasma. Hypocalcemia producing tetany may occur following massive transfusion of citrated blood. AIDS. Acquired immune deficiency syndrome is characterized by reduction in the number of helper T cells because of the infection with the human immunodeficiency virus. AIDS is the major wild-wide life-threatening disease spreading rapidly. Infection occurs when a glycoprotein from the HIV binds to the surface receptors of T lymphocytes, monocytes, macrophages, and dendritic cells, leading to destruction of these cells. It causes slow progressive decrease in the immune function, resulting in opportunistic infection which killed the AIDS patient with pneumonia. After entering the body of the host, HIV activate enzyme called transverse transcriptase HIV. Reverse transcriptase HIV utilize this enzyme and convert on viral RNA to viral DNA with the help of host cell DNA itself. Now the viral DNA gets incorporated into host cell DNA and prevent the normal activities of the host cell DNA. After exposure to HIV, no symptoms will occur for several weeks. This is known as incubation period. The patient will develop symptoms when sufficient number of infected cells rupture. The common symptoms include fatigue, weight loss, chronic diarrhea, night sweat, oral ulcers, vaginal ulcers, etc. The mode of transmission, it is transmitted by secretions from the body of the infected individual, come in contact with the blood of the recipient through damaged skin or mucous membrane. The most common ways of infections are contaminated blood transfusion, contaminated needles, or other invasive instrument transmission from mother to child during delivery or breastfeeding or vaginal sexual intercourse. Prevention. Public must be educated about seriousness and prevention of disease. HIV-infected persons should be educated to avoid spreading the disease. The blood should be screened for HIV before transfusion. Intravenous drug users should not share the needle. Pregnant women should get blood tested for HIV. If the mother is infected, treatment with pseudovidin may reduce the incidence of infection in the infant. Young adults and teenagers must be informed about safer sex techniques and use of condoms. Leukemia. Leukemia is a malignant disease of white blood cells. There is an uncontrolled production of RBC with plenty of immature cells. The classification, depending upon the cell type, it is classified into lymphocytic leukemia and myeloid leukemia. Depending upon time duration, it is classified into acute leukemia and chronic leukemia. Lymphocytic leukemia, there is an uncontrolled production of lymphoid cell. Myeloid leukemia, granulocyte is the precursor increase. Myeloid leukemia can be neutrophilic leukemia, eosinophilic leukemia, basophilic leukemia, or monocytic leukemia. Leukemia can be well differentiated and undifferentiated. In well differentiated type, the disease have chronic course over 10 to 20 years. Undifferentiated type disease have acute course and often lead to death within few months if untreated. Cause of leukemia: ionizing radiation, cytotoxic drugs, mutation and immune deficiency status, extramedullary hematopoiesis take place, leading to enlargement of liver, spleen and lymph nodes. Leukemic cells of bone marrow invade surrounding bone, leading to bone pain and tendency to fracture easily. Bleeding tendencies such as purpura, epistaxis, and gum bleed occurs. Diagnosis not obvious and it is uncovered by laboratory investigations. Anemia and thrombocytopenia may occur in some cases. Neutrophils, they are also known as polymorphs, have fine or small granules. Mechanism of action of neutrophils: they are released in large number at the site of infection from the blood. At the same time, new neutrophils are produced from the progenitor cells. All neutrophils move all diabetes towards the site of infection due to chemotaxis. Respiratory burst: if this rapid increase in oxygen consumption during the process of phagocytosis, neutrophils and other phagocytic cells. Pus and pus cells: pus in the whitish yellow fluid formed in infected tissue by dead WBCs, bacteria and other foreign bodies, and cellular debris. It consists of WBC, bacteria, other foreign bodies and cellular debris. Thank you. Thank you for listening. If you have any comment, please do comment me.